Good morning. I'm here with Jen Ribar, who is our current AFDMA President, for a brief interview to get to know Jen and also get to know your board members. So first question I'd like to start with is how did you get into FDM? How were you first exposed?
Yeah, so I was first exposed to FDM. I was thinking about it, and it was actually 10 years ago, right about now. Had just graduated college and was a pre-medical student, and I, interestingly enough, was just going to a regular doctor's appointment, and a student from PNWU was rotating with my physician. And so, of course, I'm like, oh, I want to go to your school. What do you think about it? Blah, blah, blah. And he was like, you should shadow Dr. Capistrant. He's over at one of the urgent cares in town. He's like, and before you go, look up this thing called fascial distortion model, and you'll super impress him if you pull out some of the words from that. And I was like, okay. So I moved into a house recently, and I was unpacking some old stuff, and I actually found my notebook from when I shadowed Dr. Capistrant 10 years ago. And it had continuum distortion in there, and I thought that was really super cool.
Uh-huh.
So I went and shadowed Dr. Capistrant, and then we talked a little bit about FDM. I still had absolutely no idea conceptually, but I was like, cool, I can throw out these words and impress this doctor. But the next fall, I went to PNWU, and at that time, Melissa T. Tamble was the head of our OMM department. And she didn't allow first-year students to go to the FDM modules because she wanted the students to get their full first year of techniques first. But when Todd came down and did a module 1 in the spring of my first year, I snuck into it and kind of sat in the corner in the back. And I very vividly remember being there, and he played some of the videos with fascia, and I was just enamored. Like, this is the coolest thing ever. And after that weekend, I went back and I got a bunch of my fellow first year students together and just basically said, hey, here are these 6 distortions. This is super cool. Maybe we could start practicing it. And from there, just went to a bunch of different modules legally after that first one. And then in my 3rd year of medical school, I was the only student from my class that came up to Fairbanks, Alaska, which is my hometown, hence why I shadowed Dr. Capistrant before going to medical school. And because I was the only student coming up, PNWU requires all of their students to do a 1-month OMM rotation. Not every school requires OMM, but PNWU does. Mm-hmm. And Todd had this idea that since I'm here for a year and it's just me, why don't I do a rotation over the entire year? Instead of just doing a 4-week rotation, do it over the entire year, where I spend a half a day a week, essentially with him, because he was the only person in Fairbanks doing as much OMM that he does at the time. And so I would be in my surgery rotation, but I'd spend half a day a week and go do OMM with him. And I was kind of a pilot program, and I got so much FDM that year that that was the path that was set out for me. So
wow, cool. That's amazing. I didn't know that about you. That's really cool. So you pretty much dove right into medical school knowing fascial distortion model, having had some exposure. How is the practice when you were shadowing Todd 10 years ago versus now?
Super different. Yeah. Because now I'm in Todd's practice, so I'm one of his partners now, which is super kind of cool to have that go full circle. But when I first started with him, he was still working in the urgent care setting and would just treat patients that came in with certain types of pains with FDM and OMM, and occasionally have scheduled visits. And then throughout my 3rd year there, my 3rd year medical school, he eventually had created his own little department, even though it was just him. And he stopped doing the urgent care and was just seeing scheduled OMM patients because it was getting so busy.
Yeah.
And then it just evolved from there to now we have a 6-person practice that's OMM here.
That's amazing. That's the OMM practice dream.
Right.
Something I'm aiming for. Very cool. So having started so early, now you're AFDMA President, how's that been going, and what are your visions for the end of your term?
Yeah, so I tell people all the time, I was pretty much born and bred into FDM in my baby OMM career, baby DO career. And so it's hard for me to, you know, take them apart. Just traditional OMM techniques and FDM to me are all the same. And my vision for FDM really is to have FDM embraced by the entire osteopathic community. We're a little ways away from that, I think, but it's really been great to see over the last couple of years a lot of the hard work that Todd Capistrant, Gene Leonard have done, and I'm hoping to continue that legacy and trying to help osteopaths across the country and across the world really understand the value of FDM. And I would love to see it, you know, as AFDMA is continuing to do, see it as a cross-specialty, cross-training, integrated together, physical therapists, athletic trainers, chiropractors, and basically everyone working with FDM for the common goal of trying to help decrease the amount of pain people are having.
Yeah, absolutely. That is definitely a good goal. Having, again, been born into osteopathic medicine with FDM, how different was it going to MSU for residency? Because I know they're not huge into FDM there prior to you.
Right. So they had, at the school, had, I believe, just one module before I went there. Dr. Capistrant had gone out there and done a weekend with their statewide campus system. So it was, some people knew about it, but kind of not really a very popular thing. But when I went out to do my interview, John Bruner was the program director of the residency, and he had some familiarity with it, and he was really excited, as well as some of the other people there. And I basically went into all my residency interviews saying, hey, I do FDM, and it's not something I'm going to stop doing. Yes, I want to learn everything else you guys have to offer, but I just want you to know that FDM is a part of me, and I'm not going to compromise on that. And the MSU was all in on that. They're a very biomechanical school. That's how they, and residency, that's definitely how they describe themselves. But my time there was so invaluable in terms of what I absorbed from all of my attendings there. Lisa DiStefano, Matt Zatkin, Tim Francisco being the main attendings that I worked with when I was there. But it was really kind of fun because of how much I was still utilizing FDM and growing in my FDM training, that by the end of my residency, some of my attendings, there's about 13 or 14 attendings in the clinic itself. And there is a couple of people that would actually refer patients to me as a resident to use FDM on patients that had some tricky diagnoses. So that was really cool to see how well they embraced me and FDM. And now, since I've been gone 2 years, and they still have residents that are using FDM and attendings that are dabbling in it. So I'm excited that I was able to help contribute to leave that impact. But what they all taught me there just has enhanced my ability to utilize FDM.
Yeah, that's great. That's great, because I have a little bit of a history with MSU too, and it's kind of come around full circle because Darren Grunwald, he helps to run the SES system there. And after you were there, he knew that I was heavy into FDM and got into it and invited me to go do a weekend to teach the residents for SES. And that was really surreal. Being on the other side of the lectern in the OMM lab, it was kind of funny, but yeah, it was a really cool experience.
Yeah. I really like seeing how well, because MSU is not just those at MSU, it's in Grand Rapids and Muskegon and other places in the state that have started to embrace utilizing FDM and training in it as well. So it's been really awesome to see.
Yeah, absolutely. And there's some P&W people that I know that are over doing some residencies there, like Jen Humble. Also, I don't know if Nikki is PNWU. Nikki from Merrick is also in Michigan at Grand Rapids, and she's heavy into FDM. So it's nice to see. It's nice to see it going around and coming full circle. And hopefully we have a strong future that will just blow up soon.
Yeah, it's been great. When I was at MSU, the residents teach in the OMM and the OMS 1 and 2 classes, and we had this thing when I was on campus that I called Fight Club, FDM Fight Club, because we would meet after hours and just do FDM stuff. It was very informal. It wasn't a club. It was basically like, hey, I have a key to the OMM lab. Sorry, Michelle. I have a key to the OMM lab. We're just going to go use it this time and this date, tell your friends, but no like advertising. And we would go do it. And back in July, I had a student from MSU that was a first year when I was in my last year residency that was part of Fight Club. And she came up and did a rotation with us here in Alaska. So that was really cool to be able to have that kind of carry through a couple years later.
That's funny. I think I did hear of that Fight Club from Tom Kinklow.
Yes. Hopefully they're keeping that spirit going.
I think so. I think he's going to be headed out to West Coast soon, possibly.
Good for him. Good.
Yeah. It'll be cool. Yeah, looks like we've got a lot of good people coming out of Alaska as well as MSU. So very cool. How has COVID and this pandemic affected your vision for FDM or affected ideas for spreading FDM?
Yeah, it's been really interesting because we've been talking for a really long time about integrating some online teaching and video capabilities to help with some of the access to classes and to the FDM information. And though we still haven't developed anything formally yet, I think that this has pushed us to make it faster as AFDMA, as an organization that's trying to reach out and teach people. And I've dabbled a little bit. I was supposed to do a module at Rocky Vista University back in April. And since it got canceled because of COVID, I still did a few hour kind of intro talking about it was supposed to be module 2. So we focused on some spine techniques, and I was able to do it via Zoom with some of the students that were scattered across Colorado, not all in the same place. And it worked really well. And it was cool because because FDM is so patient feedback driven, it's something that you can teach and utilize to some extent virtually. So we were able to talk, one of the students who had a partner in her home was having some back pain. And so we actually talked her through a treatment that turned out really successful for that day. So that was really cool. And it was very just for the moment. It wasn't even planned. She was just like, hey, I have somebody, can we do this? And it worked really nicely. I don't think FDM is something that can be taught in its entirety, because you're really having that feedback from a seasoned practitioner and an instructor to understand some of the vector forces and things like that. It's the in-person is definitely cannot go away, but I think there's some value in utilizing online teaching modalities to help people continue with their education and learn some of the basic techniques. And I've been getting good feedback from some colleagues that were forced to do telemedicine visits for a while, that we can even use it to treat patients in a virtual telemedicine visit, to have them either do a self-treatment with trigger bands, HTPs, foldings, or have a partner or friend or other person in the house help out with that too. So it's been forcing us to get creative in these different ways, and in ways that I'm excited about, actually, things that, treating a patient virtually has never been something we've thought of before.
Right. Yeah. That's definitely brought out some creativity in some people.
Yes.
And you've seen that on our Facebook study group. I think we might be referring to this, or thinking of the same person, Mark.
Yeah.
In Bellingham. Yeah. That was a really cool thing to see.
Yeah.
Yeah. So is there anything else that you wanted to talk about as current AFDMA president?
Well, I think that the other things that this pandemic has brought about is sort of some more international conversation. We were supposed to have the World Congress in November in Japan, which I know everyone was very excited about. There was going to be some really awesome lecture topics coming out of the US. We had a handful of speakers that were selected from AFDMA to go speak. And while it's really unfortunate that it's not going to happen, I'm hoping that we can collaborate with the EFDMA, AFDMS, and the other organizations internationally to try to help get that content out there, regardless of when the Japanese World Congress is supposed to be held. We're hoping it gets rescheduled because we'd all love to go see Osaka and see our colleagues in person.
Yeah.
But I'm excited about pursuing these virtual ways of sharing this information.
Yeah. 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 I was definitely bummed about not being able to go because I was looking forward to going to Japan for the first time.
Yeah, me too.
One day.
Yeah.
One day.
Yep. It'll happen.
All right. Well, thanks for agreeing to this on a Sunday morning at the last minute. I really appreciate it. This is definitely, hopefully, something we can continue doing and utilize our YouTube more and our website more as AFDMA.
I hope so. This is great. Thanks for doing this, Angela.
Yeah, of course.